Reporting live from Bedrock Studios in downtown Shreveport, the Sleep Easy podcast hosted by Tiff B.
Welcome, everybody, to the second installment or episode in the series. And the title today is Hypoglossal Nerve Stimulation. Inspire. Would you rather be inspired or do you want to expire? You choose. All right. This is the podcast where we will be discussing cases in 15 minutes or less. I want to say thank you to our sponsors, the same sponsors we had last time, except for a little bit of change. We still have the Happy Nap CPAP. Again, if you don't have a Happy Nap CPAP, then you're probably having crappy naps. Get this. And then also, remember Lolo's leads for the Lolo? Well, Lolo got out of the business. He started selling Christmas trees. So he turned it over to his twin sister, Lala. So now it's Lala's leads, but you can still get them for the Lolo. Don't forget about these. All right, hypoglossal nerve stimulation. We're building a case today, or discussing a case rather, on a 78-year-old male. I was gonna say 78-year-old white male, or Caucasian male. And some people say that that's not important. I don't have to say that. However, I think it is kind of important because maybe later on down the line in research, we'll learn that the color a person's ethnicity may have something to do with sleep disorders. Who knows? We'll see later on down the line. All right, so I'm building my case or discussing the case on a 78-year-old male who has had the Inspire hypoglossal nerve stimulation surgery performed. But I want to take you back. I'm going to give you some background information before we jump right into the hypoglossal nerve stimulation. Back in March of 2018, this male came in to the sleep clinic. His Epworth Sleepiness Scale score was at a 10. His weight was 175 pounds. His height was 73 inches, and his body mass index was 23.09. That was at the beginning. So he comes in, he gets an NPSG done, sleep study. The findings are that he does indeed have sleep apnea, obstructive sleep apnea. But I also want to let you know that his past medical history did have hypertension, GERD, which is gastroesophageal reflux disorder. I wrote that down all the way out. But anyway, he did have that, as well as anxiety and essential tremors. So he was also using 5 cups of coffee. He was consuming 5 cups of coffee before 2 o'clock every day. So anyway, again, this was back in March of 2018. So he gets diagnosed with obstructive sleep apnea. He gets placed on CPAP. Well, the CPAP begins at the CPAP is titrated and he ends up being on BiPAP. So here we go. April of 2018, he's initiated on BiPAP. Starts at a level of 23/19 with heated humidification. He comes back a year later in 2020, that BiPAP is up to 24/20 with an average apnea-hypopnea index of 1.8. He comes back the next year, March of 2021. The initial BiPAP is still at 24/20. Average AHI, 4.2. March 14th of 2022, he's back for his annual checkup. The BiPAP is 24/20 with an average AHI of 11.6 with mostly hypopneas. Now, there's only a 4-month difference in this next appointment, which is on July 29th of 2022, where he comes in and the BiPAP is we go up one, and it's 25/21 with an average AHI of 5.1. He comes back January 27th of 2023. At this time, the BiPAP is still at 25/21 with an average AHI of 6. However, during this time, he lets us know that he has been hospitalized because he's had a collapsed lung. So at this time, January 27th of 2023, we go back to CPAP. And the initial CPAP is 23/19 centimeters of H2O. And again, this is right after he's hospitalized for collapsed lung. Okay, so let's jump up about 8 months later. In September of 2023, the initial BiPAP is still at initial CPAP is at 23/19 centimeters H2O with an average AHI of 5.5. Okay, that's September of 2023. Here in October of 2023, the patient decides that he wants to do the Expire, which is the hypoglossal nerve stimulation surgery. And you ask, what exactly is a hypoglossal nerve stimulation? And what you need to know is hypoglossal nerve stimulation is an implantable device used to treat obstructive sleep apnea. The device detects each breath and sends an electrical impulse to stimulate the nerves that move the tongue and open the airway while the person sleeps. A hypoglossal nerve stimulation implant is an alternative for patients who cannot tolerate the CPAP. Because after the patient, and I gave you that little tidbit, because after the patient had the collapsed lung, it was then, before that, he was tolerating the BiPAP and everything, wasn't complaining about anything. But after the collapsed lung, he starts having complications. He starts complaining of he is unable to sleep with his BiPAP. So that's why and also he gained 23 pounds from April of 2018 to October of 2023. All right, so we got the patient who now cannot tolerate the BiPAP and has gone to the doctor to see about getting the Expire due to the, well, I'm not going to say due to it, but I think that the collapsed lung did have a lot to do with it. At first, he was denying difficulty, but now he was complaining of mass discomfort, pressure intolerance, mass leaks, nasal congestion, dry mouth. He was wearing a full face mask, and he was less than 6 months old, but he was also having difficulty initiating and maintaining sleep. So here we are on the path to the Expire. Okay, so the before the Expire is done, and there has to be an OTC study done. So the doctor orders the OTC study. The patient does and OTC means out of center study. The patient does the out of center study, and he comes back, and what we find is that the OCST does suggest the sleep disordered breathing, but we already knew that. And it also had a desaturation index of 22.6 an hour and a minimum saturation of 85.0%. And the plan was to go ahead and to go forward with the Expire. All right, the out of center study report showed. Can you see my report? showed 8 hours and 35 minutes total recording time. Lights off was at 10:38. Lights on was at 7:12 a.m. Total sleep time was 3 hours and 58 minutes. The sleep efficiency was 46.4%. The sleep latency, 6 minutes. Wake after sleep onset was 4 hours, 29 minutes. The duration of wake was 4 hours and 35 minutes with a 53.6%. And the sleep was 3 hours and 58 minutes with 46.4%. And here you have just a little simple hypnogram that shows you everything, that we talked about. It shows the respiratory disturbance index 158, which is 39.7. All apneas 158, 39.7. Obstructive 110, 27.7. Central apneas none. Mixed apneas none. Hypopneas 48, 12.1. Obstructive hypopneas, central hypopnea 48 obstructive, no centrals, no mixed. DSAT 90. All right. The oxygen saturations you can see right here. Minimum was 85. The mean was 92, while the maximum was 97. And that's all of that. Snoring count 32. So that was all of the information from the outer center study, which let us know that he was a good candidate for the Inspire. And those are just all those, the hypnogram for all those values that I just gave you. Okay, so he gets okay to get the Inspire. He gets the Inspire, and after you get the Inspire, you have to come back because it has to be what is called fine-tuned. And that is where I met this patient. After giving you all that background, that's where I met the patient, when he was at his fine-tuning appointment. Okay, so what happens is they go once a month. Once the Inspire is implanted, the patient returns to the clinic 30 days later to get it fine-tuned. When the patient came back in 30 days later was in May of 2024. So the initial, when he came back initially, he was at, his Epworth sleepiness scale was at a 2, and his insomnia severity index was at an 8. The tongue has to be, there's a test that they do called functional tongue exam, and it is done to rule out any sign of neuropraxia. And neuropraxia is nothing but, I don't mean nothing but, neuropraxia is a mild nerve injury where the nerve loses motion or sensory function, but it can heal on its own with time and rest. So the patient comes in, 30 days later, his functional tongue exam, he was conducted, and there was no signs of any neuropraxia. The amplitude of the device for his Inspire was set at 0.4, and that's measured in volts. So it was set at 0.4, and what happens is the patient uses the Inspire, and they go up 1 every week to see what their desired level is. So the patient started, like I said, on an amplitude of 0.4 volts, and that was in May of 2024. He comes back in June of 2024. Epworth sleepiness scale still at a 2. The ISI, which is the insomnia severity index, is still at 8. However, he is not, and his level, the level is still the same. The patient is using his device nightly and is currently on level 3 with an amp of 0.6 volts and plans on moving up to level 4. Okay, that was in June. In July, the patient has stepped up to level 7 with an amplitude of 1.1. He's using it every night. He's getting an average use of sleep from 9 hours, roughly about 9 hours and 29 minutes a night. The patient is reporting that he feels more rested during the day and is experiencing an energy surge. He also states that once he went past levels 4 or 5, he didn't feel as well with his Inspire device. So level 4 or 5, he didn't feel so well. Okay, he comes back in September of 2024, and he has stepped it up again. His Epworth sleepiness scale is at a 4. He uses it still about 70 hours a week, 9 hours and 25 minutes of sleep. He reports that he turns his device off in the morning, and his speech, he has noticed, is kind of slurred. However, he is okay at this time. You know, he has decreased his level down. He has decreased it back down to level 1, and we're gonna monitor that. Okay, so now we're in October of 2024. He is using his device 70 hours a week. He's at level 4 with an amplitude of 0.7 volts. He still reports he's not feeling as rested as when he first started the device, but there is no snoring. There are no issues with the device waking him up. His current setting is at an amplitude of 0.7 volts. The lowest limit that he's gone is 0.4 volts, and the highest that he's been is 1.4, with a 30-minute start delay and a 15-minute pause time. Epworth sleepiness scale has gone up to a 5, and the insomnia severity index is at an 8. Okay, the tongue test was done, no protrusion was assessed, and the patient was set on level 5 on this day. Okay, let's go to November of 2024. He is using his device 70 hours a week with a mean of 9 hours and 26 minutes of sleep a night. He's currently on a level 6 and an amplitude of 0.9 volts. He reports that he is feeling more energized during the day, and there is no mention of snoring. He does continue, however, to have minor slurred speech. Okay. Epworth sleepiness scale is at a 3, and his insomnia severity index is at a 7. Okay, so now we are currently at February of 2025 when I actually meet the patient. At this time, he is using his device 70 hours per week with an average of 9 hours and 26 minutes. He's currently at a level 6 with an amplitude of 0.9. He reports that he is feeling more energized during the day, and there is no mention of snoring. He does continue to have the minor slurred speech in the morning, and he says, quote, "I can also feel the device in my throat when I first wake up." He denies any pain or discomfort, and the device is not waking him up during the night. The current setting is at 0.9, with the lowest limit having been 0.4, with the highest limit at a 1.4. There's a 30-minute start delay, 15-minute pause time, and 9-hour therapy duration. The Epworth sleepiness scale is at a 3. The insomnia severity index is at a 7. And the patient reveals that there has been no change since his last visit. Now, the tongue protrusion test was good. It was noted that it was good, and the patient is denying any pain and discomfort at this time. His past medical history did not have any major medications. That's why I didn't say anything about his medications. He's on aspirin, iron with vitamin C, oxybutynin, metilocast sodium. So no major medications. Because now we started out with him being a 72-year-old male, and here in 2025 he is a 78-year-old male who has gained, whose height is still 73 inches, whose weight is now 198, and his body mass index is 26.12. But what we have learned, and here are the stats from the Inspire study report, because Inspire does have its own study report. The polysomnography was conducted on the night of 2/20/25, and all the parameters were monitored. You can see that here. And the tracing was scored using 30-second epochs, and hypopneas were scored per the AASM definition with a 4% DSAT. So we have everything here. Lights on. I'm sorry, lights off, 9:59. Lights on, 5:57. Total sleep time, 277.5 minutes, with an apnea-hypopnea index of 5.2 an hour. A respiratory disturbance index of 14.3 an hour. Sleep efficiency, 58.1. Sleep latency, 80 minutes. The lowest SpO2 was 88%. Periodic limb movement index, 157.6. And there was no REM sleep. No REM sleep was ever reported for this patient. He was in, with the total time in bed, 477.5. Sleep period time, total sleep time, 277.5 minutes. Sleep onset, 80 minutes. He was in stage 1 for 80 minutes, stage 2 for 93.5 minutes, stage 3 for 339.5 minutes, and there was no REM sleep recorded. During that, central apneas, obstructive apneas, mixed apneas, there was a total number of 12, with 4 being central, 8 being obstructive, and you can see that here. The means are all there. The indexes, the REM count, the non-REM count is all here. Total sleep time in events, with the hypopnea summary, as well as the AHI summary. And that's here on this side. Average rate during sleep, 50 heartbeats per minute. Highest rate, 255 beats per minute, highest rate. Okay, so that's all there. There it is with the REM, the non-REM, the leg movements, the snoring, and everything. The arousals plus awakenings, 52. The arousals plus awakening index, 11.2. So, with all that being said, I think it is safe to say that Inspire really did help in this situation. Here's also the voltages at which he was at, the 0.8 voltage, and when he went up to the 0.9 voltage. So, I think it's safe to say that Inspire really is a good method for somebody who cannot tolerate CPAP, BiPAP. So I hope that this was interesting, and I hope that that our case was built. The final findings were in a very good spot with this patient, and his goal and plan is to meet with his doctor, his primary care doctor, again in a year. I just want to say thank you for listening to the Sleep Easy podcast. And at the end of the day, it's night. And I hope you make it a good one. And sleep easy, baby. And let's not forget, I can be heard on KREM station, 9:30 p.m., as well as I can be heard on WAKE at 4:20 a.m. I'm out.